Can I have my slides also started? Hello? Can I have my slides? In the name of God, passionate and the merciful, I'm Dr. Majid Fadey, and I am very happy that today I am having or talking to you, friends. Hope in a period of half an hour to 45 minutes, I will be good enough to explain to you what is auriculotherapy and what are its indications and where it can be very effective and where it might not be beneficial. It is better I first introduce myself. I am Dr. Majid Fadey from Iran. I have more than 20 to 25 years clinical practice in acupuncture and air acupuncture. And I have been learning and teaching intermittently. I have had many classes from Iran and outside of Iran, and we have invited many great teachers to Iran and have conducted many classes in Iran for medical students as well. And I have been working in different universities as a lecturer along with the other colleagues and in different hospitals, and seeing many different patients. And I've seen many ups and downs in clinical practice, many successes and many failures. And this experience has helped me to better understand auriculotherapy and acupuncture. Next slide, please. I would like first, one back, please, back. Thank you. First, I will tell you about my journey in auriculotherapy. Before going to China, I was invited to a clinic with one of the doctors who was practicing auriculotherapy. And what he showed me that time, it was amazing for me as a medical doctor, but I could not believe what I saw. And I could see a backache or sciatica pain to go in a minute. And but I would not believe my eyes. I mean, I could see the patient in a few minutes stand up and say, "Doctor, I don't have pain," and we could see a great improvement. But being a medical doctor, I could not accept this, and I could not believe that this is happening. So a few days I worked with that doctor, Dr. Navidi, and with all my contradictions and fights going in my brain that this is not possible, how can it happen, and what so and so. So I went to China and saw 4 more patients. Then I came back. But what I saw in my country with Dr. Navidi was, I can say, far more advanced that I had experienced in the years before. I can say, first, it is good to know that who was Dr. Navidi. Dr. Navidi was a cardiologist who had graduated from Germany. And in Germany, he had learned air acupuncture. But what he showed me was magical results. And this discussion is about 20 years old almost, because it was before me going to China. And he was very well experienced. And I think he was around 60 or 65 when I saw him. So from there, he produced a small change in my brain. And he said, look, these are what can happen. These are what possibilities. But my mind was blocked by my medical education, that from the medical educational point of view, this, with this speed, with these results, is impossible. So I went to China. I had my learning and training there. Then I came back to I went to Pakistan. There I saw, with my friends, we saw a lot of patients. Then I came back to Iran and started working. And I contacted Canada for having certain learnings from them. Then again, I applied those informations, and I used to teach in between to many medical doctors that what I had learned. So we slowly improved our clinical practice. Then we invited German doctors to the Iran to teach us more advanced levels. In between, I was invited to two medical universities, I mean, far before this, of course. And we started practicing in the medical universities where there were residents of sport medicine, physical rehab. And there we started practicing more and more. And the thing got very serious. So we started applying different techniques and getting different results. And we saw, no, our mind had to learn to look differently and get different results. Then we introduced different codes for medical doctors and so on. The Iran entered to this journey of auricular therapy. Can we have the next slide, please? اسلاید بعد رو میزنید، متشکرم. Now I better give you a brief history of auricular therapy in the world. Next slide, please. Auriculotherapy was introduced to the world by a French doctor named Paul Nogier. In around 1950s, a patient goes to him and the patient had a burn scar on the ear. And when he asked that what has happened, and the patient explains that they had backache and they went to a village and there they produced burning on the ear and the pain vanished. So he thinks that if this is the point for L5S1 for most of the sciatic nerve compression, we know that L5S1 is involved. So he thought that the rest of the map can be produced. So Paul Nogier tried to produce the map of the body in the air and then introduced it to the world. I think it was about around 1956, which introduced to the world what he had discovered from that event in his clinic, that how the patient had reported. And then different schools started working on these science. Can I have the next slide, please? Slide بعدی رو, yes, okay. After his discoveries, Chinese came to the ground and they started working on his thesis and in his finding. And then they went back to his own history and they found that, yes, they had a lot of information also in the China Acupuncture Society, I mean the books, and they started compiling the more information. And a group of scientists or more group of scientists came to the work, and this science started becoming bigger and bigger. There is a difference that it is good I mentioned here. We have two schools from this time. One is French school. French school of auricular therapy is on the basis of medical sciences. I mean, we know where is the stomach, where is the spleen, where is liver, what are the nerve origin, what are the stimulation, how these are working. Chinese auricular therapy basically is on the philosophical look to the human body. And they started replanning or reteaching what was brought up, but with the background of philosophical look of Chinese traditional medicine. But everything could not match. So when we read Chinese auricular therapy, we can see 60-70% is still like Western medical auricular therapy. 20-30% is like philosophical approach auricular therapy. So we could see these are going together, but it didn't stop us and help to progress more, because two philosophical approach could improve the condition far more. One was medical approach, one was philosophical approach. Now we go to the next, please. Then came German auricular therapy. Along with French auricular therapy, there were doctors named Dr. Barr, or now we call him Professor Barr. Professor Barr worked with Professor Nogier, and they developed the auricular therapy. Then Professor Barr went back to his own country, to the Germany, and as we know, he produced the German Auricular Institute, or we call, I don't know how to translate it. Anyhow, the German auricular therapy started growing far fast, and Dr. Barr introduced many more points, which are for us very, very amazing. Therefore, in the books we see, when we read, they say the works of Dr. Barr and Dr. Nogier for the auricular therapy. Now, important things about German auricular therapy, that they helped in advancement of auricular therapy, but with the concept of medical doctors, far, far more on the basis of pathophysiology of the disease, on the basis of how the disease progresses, but with the medical look, not with the philosophical look. So this, the way we look to this medicine with the medical look helps us better to understand the pathology and the treatment lines. And medical doctors learn it very, very much faster, because to a medical doctor explaining the nerve, vagus nerve, trigeminal nerve, autonomic nerve, they can understand it very well and very easy. But when we talk about energy balancing, yin, yang, and we talk about deficiencies and excess, which is coming from the Chinese philosophy, doctors might not be able to understand very well. Therefore, they need a lot of more times to learn and to go to the college to learn the basics of Chinese philosophy. But German auricular therapy and French auricular therapy are basically on the basis of Western medical, which makes the transfer of the information far more easier than Chinese in certain level. Okay, now we go to the next step. Slide بعدی رو لطفاً. Now, I like to here introduce Persian and Auricle. We could see in some texts that they had mentioned that Persians or old Persia used Auricle for certain diseases. And we could see in American books that they had written this, but we could not find the resources that from where they know this. Till I think last year, we did a search in many books and we found, yes, I think 50 or 100 years or 200 years before the discovery of auricular therapy, and we have its own documents. Iranian used auricular bleeding methods and burning for controlling certain diseases. And it was very, very important, the comment that that traditional physician had put, that in certain difficult diseases, they used to bleed the air or they used to burn the air. And this was very, very interesting for us, that in Iran, in old Iran, there are traces of information or traces of documents which tell us in old Persia also, Iran used to use parts of the air for treatment of certain diseases. Next slide, please. Now we say about auricular therapy in Iran. Why auricular therapy in Iran is, I can say, very, very much advanced. Around, I think it was 10 to 12 years ago, me and Dr. Ayati and certain other colleagues from Iranian Medical Acupuncture Association, we planned a training course for medical doctors. And the university accepted this training. Of course, we worked around 6 months to get this acceptance. University accepted this teaching and we started teaching. And we conducted around 4 courses for medical doctors. And those 4 courses, many medical doctors came in, from general practitioners to a specialist to super specialist. And they took the information and went back to their clinics and hospitals and started working on that practice. And that helped us to grow more. And for example, now we have clinics for pain control, we have clinics for cancer pain control, which are in auricular therapy. And most of these people who are working in these fields are specialists and super specialists, which are tackling difficult pains, not easy pain. I mean, when we say cancer pain is not joke. When we say severe DJDs, or where we cannot operate, and these doctors can tackle the pain. And this teaching helped Iran to have a root in auricular therapy and make it grow more. And after it went to the hospitals and medical institutions, the growth improved manifold. After that, Iranian Medical Acupuncture Association conducted many courses in different universities and different colleges. This helped us to grow far more. Important of this in the medical field is that you cannot teach everything in the medical colleges. Medical colleges have, or students have, many questions, and we should be able to answer their questions. When we talk philosophical, they may not understand, but when we talk about these diseases on the basis of Western medicine, and when we try to treat them, and when we show result, then they will believe, and they accept, and they help in growing this science and improving it. Since we took it to the universities and we took it to the hospitals, the need increased for the need of the patient increased, and they improved, and many doctors came in to learn more and apply this science more. Next slide, please. I can say that at that time, more than 175 doctors were trained. Then, by the help of different colleges and Iranian Medical Acupuncture Association, I think we're around about 600 to 700 doctors were trained in this field. Why it is good? Because these are mostly short courses, and after learning, the clinician can go back and practice. And slowly, we guided them, and we, what we can say, we helped them to solve their questions and improve it. Therefore, I can say a great improvement was produced by acupuncture application in different medical colleges. As I said, 4 courses were introduced to the medical doctors, and then 4 more cases. Now, here I would like to see I would like you to see these names: air acupuncture, auricular therapy, and auricular acupuncture. Look, we have different things: air acupuncture, auricular therapy, auricular acupuncture. I think air acupuncture and auricular acupuncture are mistaken, and they are not the proper name for auricular therapy. Later on, I will explain why. Because when we say air acupuncture, we may think of needles going to the air. Or when we say auricular acupuncture, same things. But auricular therapy, meaning application of different methods to stimulate the nerves through the auricular, external auricle. It doesn't mean needles. It can be lasers, it can be massage, it can be sealing, it can be minor surgical procedure. So I would suggest you not to use air acupuncture or name of the air acupuncture or auricular acupuncture as they are written in many books, and we better use auricular therapy. Now we say, what is, next slide, please. Now it is good to know what is auricular medicine. So we got introduced to auricular therapy. Now we say, what is auricular medicine? Auricular medicine, when we mention this term, it has two meanings for us. One, auricular medicine was introduced by the Germans and by French doctors. That is when we use pulse of the patient to find certain points. And that is very advanced technique, which we call it sub-branch of the body bioresonance. And one is auricular medicine, which Dr. Huang from China also introduced. That is treating various diseases through the auricle. It is not that auricular medicine which French or German introduced. So auricular medicine, which German or French people are talking about, is far more advanced and for more hard clinical cases, which we use auricular medicine. But auricular medicine in the Chinese book means medicinal diseases and using auricular application for those diseases. So it depends who is writing the book or who is the author. Chinese, what they mean, and French or Germans, what they mean. Next slide, please. So now I want to give a very, very simplified description of what is auriculotherapy from my point of view as a medical doctor experienced in auricular acupuncture. From my point of view, auriculotherapy is, when we simplify it, is external stimulation of external air via different methods. These methods can be massage, this method can be seeding, this method can be laser, this method can be needling, this method can be needling of semi-permanent needle for 2 weeks, this can be surgical implantation of the needles for lifetime. So basically, I believe auriculotherapy is external air nervous stimulation of various nerves of the air to send information to the brain and then get the responses back. So when we say therapy, it is basically for treatment purposes, not for diagnostic purposes. That is why I believe auriculotherapy is and must be in the hand of doctors, because it is therapy. It is not diagnostic. We do not diagnose, but we can say by auricular changes, we can say this patient might have problem in, for example, knee. He might have problem in the neck. He might have problem in the stomach. He might have problem in liver, but we cannot say what specifically. But a medical doctor knows how. He will do physical examination. He will do lab investigation. He will go get radiological examination. He will get MRI, and he will come up with a diagnosis. And following diagnosis, he's very, very, very powerful. I mean, became very strong to find the best method of treatment that he needs. So when we simplify, basically, we mean external air stimulation via various methods to get the nervous stimulation of the air and send the impulses to the brain and get the result and feedback. Next slide, please. Yes, here we see two air, left air, right air, like brain, right brain, left brain. And it has two surfaces, frontal surface or lateral surface and medial surface. Medial surface does certain jobs for us. Medial lateral surface does certain job for us. Before we thought that it is just a passage of air to mold and help the air pass through and we hear, but now we do not believe so. And we believe it is far more than that simplistic thinking, because we see results with what we do. We see the pain reduction, we see quick improvement, and we see amazing changes in the patient. Now we have to think why this small piece of the body of the human being can have such a wonderful and drastic results. Next slide, please. Dr. Nogier said this air of the human being is like a genome in the womb of the mother. And as we know, the genome or that kid in the tummy of the mother is upside down, head is down, and foot are up there. Now we can see this is like a kid in the tummy of the mother, and that one which I am showing is like a head part, and then goes up, vertebra is produced, and we map up the whole human body on this external air. Next slide, please. Here I'm showing part of the head. اسلاید بعدی رو لطف می‌فرمایید. صدای من رو دارید؟ اسلاید بعدی رو لطف می‌فرمایید. Here I'm showing قبلی رو لطفاً. Previous one, please. Here I'm showing the spinal cord, the spinal vertebra, which comes in the air. And slide بعدی. Here I'm showing different transition of the vertebra, which we map in the air, and we try to stimulate, and get the result. Now the question is that, is it a joke? Is it a self-belief? Is it a hypnotic effect which gives result, or it is all a lie? Now we go to the next slide. اسلاید بعدی لطفاً. Now, before I go to the main topics, I would like to say certain words that auricular therapy and acupuncture are complementary medicine. Why we call it complementary medicine? That we believe a medical doctor should practice this technique alongside his own original techniques. So it is a complementary medicine. It should come along our professional line. It cannot be separated, and I do not believe a non-medical doctor should practice this unless and until a medical doctor does everything, and that person, like an assistant, work under the supervision of the medical doctor. Now, today I will tell you how it works, possible mechanism, and we believe it is a science which all the medical doctors should learn, because it is fast, it is quick, it is safe, but only for medical doctors. And non-medical doctors can learn this only if they work under the license of chief who is a doctor. Next slide, please. Now, one thing here I want to make clear, that auricular therapy can help us auricular therapy help us to find where the pathology is, but cannot help us what is the diagnosis. But a medical doctor can conduct various methods, from physical examination to invasive investigations in the body of the patient to find the diagnosis. And after the diagnosis, he can go for treatment. Now, we should know the auricular therapy. One thing is very important to know about auricular therapy. It is, one, very, very, very fast. Two, it reduces the pain very drastically. Three, it reduces the muscle spasm very quick. So now, if a non-medical doctor comes and plays with this game, he doesn't know what is the disease. So the pain goes, the spasm goes. So when we don't know what is a disease, this is a mistake to go for treatment. But a medical doctor might think that, okay, I will do this for 1 day or 2 days and observe. But a non-medical doctor, if he doesn't know that the first reaction he gets is a decrease in the pain, the first reaction is the muscle relaxation, he might, for every diseases he gets, he starts needling the air, he will get results, but he may delay the treatment. He might delay the curing of the patient. But a medical doctor will, as he's teaching, will take a step 1, a step 2, a step 3, a step 4, and will help his patient. So because auricular therapy is, I can say, super fast in getting the result, super fast in producing muscle relaxation and pain vanishing. I mean, in most of the time, under 1 minute, we see the result. Now, if a non-medical doctor starts reducing the pain of the patient, we cannot do the diagnostic procedure. And by reduction of the pain, I mean a symptomatic approach. They might think he has cured the patient, but actually he has not. And he keeps on getting relapse. And not only the patient's healing will delay, but also the name of the auricular therapy will get damaged. I mean, it is not good that we allow this beautiful science, this quick science, the name gets damaged by a non-medical practitioners. Okay, next slide, please. Methods of stimulation. Now we have introduced a little bit of information. Now we say we want to stimulate the air to send the information to the brain, and from the brain we get results. There are many various methods that we can start treating. Now, why we should have different methods of stimulation? Every method is suitable for one group of patients. For example, auricular massage, we do it for kids or elderlies. We see many patients are afraid of needles. Why should I apply needle if I know I have to send the information via nerve? So I can massage the nerve. I can, in kids or in elderlies, I can teach them a massage. They do it at home every morning, tedious, and 3-4 days they will come back to me and I will see how much improvements there we have. Then we have auricular lasers. Lasers, we know they are very, very sophisticated and they are excellent in producing results. We have soft lasers and IR lasers, red lasers, and with a small laser lights, we can stimulate different nerve endings and we get very, very fast results. Good thing about massage and lasers are that they are painless, the people are not afraid, and they are fast, and we have a broad spectrum of applications which we can use. Then we have seeding. Seeding is that we take one seed of what we say, a plant, or we can use a small magnetic seed or plant seed. With the what we say, with a sticking material, we attach it to that place where we want treatment to go on. And we tell the patient, keep on rubbing it for 3 days. So the first 3 methods are non-invasive, easy to do, easy to handle, good for the kids, good for adults, good for those who are afraid of the needles, and we do not use needles. So we have 3 methods. Then we have needling, which itself has many varieties. Needling is good when we want to traumatize and produce inflammation in the skin and keep on nerve stimulation for a period of 3 to 5 days till 2-3 weeks. So, but the thing about needling is that people are afraid of needles. People don't like needles. People are afraid of HIV. People are afraid of infections. So needling is a method. That is why I say air acupuncture might not be correct term for us to use. So needling can have effect. People, some like it, some don't like it. So it's okay. If some patients say we don't want needling, it is okay with us. We don't use needles. We have many more methods to help the patient. We have electrical stimulations. Electrical stimulation, there are instruments which we put on the point we want to stimulate, and a short electrical impulse by the instrument goes to that point and the patient gets result. Good about electrical stimulation is that it gives very, very fast results. And it is not needling, there's no fear, but doctors should be trained about methods of electrical stimulation. Then we have thermal stimulation. We can warm up a point in the air and get the result. So as we see, we have a wide range of methods of stimulation, and these are just a part of methods of stimulation. Then we have semi-permanent needle. Semi-permanent needle, or ASPs, are 3 needles or needles which we implant in the ear of the patient for 2 weeks to 1 month. It gives constant nervous stimulation. And in the cases of anxiety, depression, chronic pain, it gives marvelous results. Results are great. And we see the patient immediately improve. But it gives a constant stimulation. The other ones are intermittent stimulation. But this one is a constant stimulation for a period of 1 to 2 weeks to 1 month. Then we have permanent needles. Permanent needles were produced by Germans. When they came to Iran to help us to learn more, they brought with themselves certain permanent needles for diseases which are not curable, like Parkinson or restless leg syndrome, which the patient has a lot of movement problem. We put permanent needle in certain point. Those needles before, they were made of titanium. This is mild surgical procedure, and only doctors should do it. Here we implant certain needles in the ear. Before, they were needles made of crystals, like salt crystals, which would dissolve slowly through 2 years period. And then they had titanium, which would remain in the body of the patient whole the life. Then they introduced needles taking care from the surgical threads, catgut needles. I mean, we have needles which can work for 3 months, 6 months, 9 months. So during the resorption time changes, and the lifetime of that needle changes. So permanent needle implantation is very, very good, and it can help for a long period of time. Germans are mastering it, and they are working very, very good on this. But the rest of the countries, according to the laws, according to the level of education, according to the who is doing it, is using the other methods. As you see, on the top, you see massaging, which is basic, very, very simplified. And the last one, which is permanent needle, is a surgical procedure. It shows us how wide is the spectrum which we can use auriculotherapy, from a massage which I teach to the mother to do it, for the children to help the tummy pain, to help them walk, to help them talk better, to have less complaint. And permanent needle is surgical procedure which we have to do under strict sterilization. And we see a very big TAFE of a stimulation method. And according to in this stimulation method, the number of the patients which can come to the clinic varies than increases. Now we have kids they are bringing to the clinic, and we have patients who could not go to the operation, and we had to implant for them. And there are far more techniques. Now, the question is, why doctors? First is, why doctors should learn this? Second is that, why short course? They have asked, okay, let me answer. The questions will be answered at the end of the lecture. Now, why doctors should learn this, and why it is 4 or 5 courses, but small courses. First thing is that all the doctors are allowed to do investigation and physical examination. As I told you, it is a therapeutic method, and it is not diagnostic. So only doctors in every country, as I know, are allowed to do physical examination, investigation, and their sign and stamp is recognized by their country to send for laboratory investigation and all those. Second thing, when a doctor comes to learn, he knows how to do physical examination. He knows what investigation he has to send. He doesn't have to be trained again in that one. He has passed 7 years of education. So he's highly qualified. Now, why short courses? Because we have to simply, for 24 hours or 30 hours, teach him the basics, then supervise him for 6 to 7 months in his own clinic and keep on answering his questions. Then again, a second level, because it is like applying an application in a computer. When we have the computer, every application installment will become 2 minutes, 3 minutes, 5 minutes. So a doctor is well equipped. So a small application is not difficult. But for a non-medical doctor, we cannot offer these informations because first he should know diagnosis, he should know pathology, physiology, what the body does, what are the nerves, what are the ganglions, how the nerves go and come, and and after that. But Chinese, they teach it to the non-medical, but on the basis of their own traditional Chinese medicine. From my point of view, this should be inherited by the doctors, and doctors should enjoy this science because it is very, very precious. Next slide, please. Which groups? We have been training many groups, from general practitioners to medical physical rehabilitation specialist, a sport medicine specialist, super specialty of the pain, anesthesia group. We have oncologists in our groups. We have heart specialists, eye specialists, and everybody is coming to learn the basic and apply it in his own field of which is he is working. Next slide, please. Okay, after these talks, which I have, I hope it has been, it was helpful for you. Now I want to give a little basic that, okay, we say from the air, these things happen. Now let's review auricular neurology in brief to see what an amazing is air. Before we could say, we would think of external air, of a tube which would conduct the air, but now we don't believe this so. And let's review auricular neurology in brief. So we will be again refreshed about the nerves are there. And the question is that, I don't know, why these many nerves are brought to the air and why this complexity of nerves are formed. So next slide, please. First nerve which comes to the air is a vagus nerve. As we know, a vagus nerve is very, very big nerve. It is one of the cranial nerves, comes back of the midbrain, comes to the neck, one on the left, one on the right, gives one branch to the air, and then goes, supplies the thoracic heart, lung, then goes to the abdomen, stomach, large intestine, small intestine, liver, and so on. As we see, this is one of the biggest nerves of the body, and it is cranial. And why it gives one branch in the air? So if the tail of this nerve in the air, what possibilities of information can I send via this nerve? As if we look to the latest articles, we see FDA has approved vagus nerve stimulation for various diseases. And two of those diseases are epilepsy and severe depression, where they have not responded to normal treatment. This is not a joke. I mean, depression is not a joke. A depression which has not responded, or the vagus or epilepsy, and many more diseases, which I request you to go and check vagus nerve stimulation. Of course, there are many methods of stimulating the vagus nerve. One is surgical, or one is through the neck, one is through the air. And it depends whether we want to go through surgical procedure to stimulate vagus nerve, or we want to go to non-invasive procedure and through the air we stimulate vagus nerve. Next slide, please. Trigeminal nerve also gives a branch in the air. And we know most of the pain of the head sinuses, duras, face, dental, all comes from trigeminal nerve. And when we control the trigeminal nerve, we can control many pains. And this is one of the big nerves which in many diseases it plays, like trigeminal neuralgia, like headaches, especially cluster headaches, which is difficult to treat, and many more types of headache. But trigeminal nerve also gives one branch here. Next slide, please. Facial nerve. Facial nerve is basically motor nerve. It also gives a lot of branches here. And we use it for various forms of stimulation. But as we see now, 3 of 12 cranial nerves are here. And now we go to the next. Glossopharyngeal nerve. And we know glossopharyngeal nerve is a great nerve which helps in better hearing, covering eustachian tube, sends information to the arch of aorta, if I am not wrong. There are receptors in certain places, and it helps many folds, which we need to review our neurology in the ear. Okay, now we have seen 4 nerves of cranial nerve. Now we say, is there any somatic nerve coming to this ear? Okay, next slide, please. Superior cervical plexus of the neck, from C1 to C4, 2 nerves from this, it means C2 and C3, from the neck origin, that comes also to the ear. So till now, we have 4 cranial nerves, which are themselves superpower and king, and 2 comes from the somatic nerves from the neck. So till here we have 6 nerves. And still it is my question, why God Almighty produced this accumulation of the nerves here? Now, the next is sympathetic nerve. Sympathetic nerve from the T1 to T5 also comes here, but not only comes here, but goes and supplies the semicircular canals. Therefore, the auricular therapy is very strong in many diseases of audition, hearing. It helps in improving the hearing of the patient. Yes. Okay. So we saw a great conglomeration of the nerves. Now we say, okay, these many nerves are coming to the ear. Is it just for conduction of the air to hear better? We say, no, we can use these nerves to send information to the brain and stimulate various parts of the brain and get different results. Now we go and see some of the indications of auricular nerve stimulation. Next slide, please. Auricular therapy has many words to say, especially in pain. Important thing is that, as we said, there we have a lot of nerves, and the nerve's speed of impulse transmission is very high. So I can say in many diseases, pain control for a professional auricular therapist is a matter of seconds before you input any injections, that the drug goes into the body and get metabolized and the patient improves. In auricular therapy, properly applied, the pain in less than 60 seconds in most of the patients, it goes down. Now in the hospitals, we are using auricular therapy for cancer patients. We have movies of the patient who had received 3 doses of morphine for breast cancer, and the patient didn't improve. The pain didn't go down. But with the application of auricular therapy, in I think less than 10 to 20 minutes, the patient became pain-free for 11 days, as to the last report. And now we are working more and more. So auricular therapy and pain control is one of the basics which is drawing more and more attention. that the people are coming just to learn how to tackle the pain quickly. But we should remember here, the pain is a symptom or sign and symptom. It's not etiology. And we should be very, very careful that when we work on the etiology and when we work on the symptom, because when we work symptomatically, etiology remains there and we keep on getting relapse. But when we work on the etiology and sign symptom at the same time, we get very, very good results. Now, the next slide, please. Now we go and review some of the indications. Of course, through the books, we will see in certain books, we have more than 200 indications of auricular therapy, but from the books. But what about the papers? Do the papers tell us more what indications we have? I mean, are there some reviews, some articles telling what indication? I tell you, in the books, we see a lot of indications. In clinical practice, we may work everywhere, because to produce a paper, it is a different thing. A clinical practice is a different thing. Clinical practice might be in certain places far more advanced than writing an article, because writing an article will have a specific indications, a specific aims, and specific objections. But in the clinical practice, the patient comes, you are a medical doctor, should reduce their pain, you should improve them and help the patient. So here we will review certain indications. Next chart, please. Next slide, please. Okay. One of the indications of auricular therapy is in substance abuse. It is used in America very much. One of the substance abuse I personally treat in my own patients is cigarette addiction. And I can see in 3 to 4 treatment, the patient from 20 to 40 cigarettes per day reaches to 1, 2, and bye-bye. And that is gone. But in other countries, they use it for different various drug addictions, and they get very, very good results. There, I don't have much experience. But in cigarette addiction, I got excellent results. Then for pain. Pain here, I have written just one word, pain, but mainly which we work is musculoskeletal pain, neck pain, knee pain, back pain, arthritic pain, non-arthritic pain, and CTS, frozen shoulder. And remember, we are working with the speed of nerve impulse. The speed is very, very fast. And you will see in front of your eyes, into 20 to 30 minutes, the thing changes. And cancer pain is also there. I request you to go to PubMed and search auricular therapy or auricular medicine and cancer pain. You will see many, many articles written by many doctors from various fields of medicine from around the world, and they are working on it. Obesity is one of other things which we treat many obese patients. It helps in reduction of the weight of the patient around 2 to 3 or to maximum 5 kg in 1 to 2 weeks. And we apply that for patients who cannot walk, who cannot manage their food intake, and they're obese. We reduce 3 to 5 kg to improve the mobility of the patient. And it helps a lot. And this is one of the best, I can say, topics which in our clinics is working very well on this. Obesity. Anxiety is there, a sleep disorder is there, and there are many more which I removed from this slide. But the evidence shows they are used less, but the number of the patients should increase more. Next slide, please. Many clinical data or reviews are done, but the number of the patients are few. We in clinical practice and in hospital practice, we work with far more patients because there is a demand and we have to treat them. And definitely the research is not ahead from the clinical practice in the hospitals, because when the patient is pain, doctor has to do what he can do. Then later on, they will come to the clinical level, and analysis and meta-analysis will come up. Next slide, please. Now we go for references for more reading. What else we can read? Next slide, please. First, I would like to introduce you certain books if you like to read, and then we will review certain headings of the articles, and then we will have the discussions. Next slide, please. Air Acupuncture, a precise pocket atlas based on the work of Nogier and Barr. Please take care of this book. This book is highly medical book, written by Dr. Beat Streetmatter, MD, second edition. This book is in English. Dr. Streetmatter from Germany wrote this, and I can say this is one of the best books, and I offer all the doctors to start with this book. This book is not very big, but is very deep, very, very deep. And medical doctors can understand this because they will not explain many things, and they will just give an outline. Okay, you should know, for example, cranial nerve examination. You should know physical physical examination. You should know the difference between radiculopathy, myopathy, and spinal nerve damage. And they will just outline that you should know what. But this book is, I can say, one of the books which will produce changes. Next slide, please. There's another book called Auriculotherapy Manual, Chinese and Western System of Air Acupuncture, 4th edition, 2014. The author is Dr. Terry Olson from USA. This book is also very great, but this is a compilation of the Chinese and Western together. Doesn't make foundations, but a very, very good book, a manual that a doctor should have if he sees various type of diseases. In the book, names the disease, gives protocols, primary point, secondary point, and additional point. The book is great if a practitioner wants to work more, and it is, I can say, a handy book for many, many doctors. Next, please. Dr. Li Chun Huang. She's from China. She has passed away. I hope, God bless her. I have learned a lot from her books. She has written a book called Auricular, sorry, the spelling is wrong, Auricular Medicine, the New Era of Medicine and Healing. This book is, I can say, I think 300-400 page, and one of the best books I have ever read that she used to work in China, and after retirement, she went to USA, and she was an army officer, if I'm not wrong, and she was working as a head of the hospital. She has written so much in this book and can say the book is full of experience. And the book is great, with great detail, but with the Chinese and medical perspective. You can see the Chinese view there, and you can see medical view there also. And certain places she goes back to the philosophy and explains the philosophy. And in that philosophy, you should know what is Chinese philosophy and what Chinese are saying. Next slide, please. These are the articles. I request you to just some of them, not all. There are many articles. Auriculotherapy for pain management, a systemic review and meta-analysis, randomized controlled trials. At the end, you will see the addresses. Of course, if you just say auriculotherapy for pain management, many articles come up. And this can help you to understand more that what systemic reviews are telling us for application of auriculotherapy. Next slide, please. And this is one of the, I can say, opening brain or future way that we should go is a review of vagus nerve stimulation. I like here to tell you not only search vagus nerve stimulation, but also search trigeminal nerve stimulation. So you will come with the titles which FDA approved and what diseases they approved. And they are, in many ways, they are trying in some of the methods. They are trying to stimulate the vagus nerve or trigeminal nerve, but more vagus nerve, through a stimulation of the air. And it is very interesting that the diseases they have shown, many of them has got FDA approved. It is not joke. FDA approves after far more researches and checking everything up and down. Then it gives an approval. So vagus nerve stimulation has come, and it is a great advancement, which I think will help with our understanding of auricular nerve stimulation. Next slide, please. And this is other article, Auriculotherapy, Neurophysiology. This article also helps us in understanding better auricular therapy and the indications. Here are more indications are given by a systematic review that what indications we can use for auricular therapy. Next slide. This is other article which can help you to review better. Does auricular therapy have therapeutic effectiveness? An overview and systemic reviews. This can help us to better understand auricular therapy. Definitely, I am an auricular therapist, and I see many patients via this method. And definitely, I am a fan of it. Definitely, I teach it always to the different doctors. But this is good that when doctors come in, they have many questions, and they find strong points and weak points. And slowly, we solve the weak points and we become stronger and stronger. Next slide, please. So now one thing is that in Iran, we have put auricular therapy in different clinics, but we do not work alone. We do our job, but we have learned to work like a team. I work, then sport medicine work, then physical rehab work. Everybody is in own place. And as a medical doctor, we know if we are strong when we work in a teamwork, and we are weak when we work. We think that one method can solve all the problem, and it cannot solve all the problem, but it can solve many problems. Thank you very, very much. And I am very thankful to you for your patience, that you spent time and you allowed me to discuss about these. And sorry if I overtalked or if the speed was not good enough. If there is any question, I would be happy to answer if I have not answered.
Thank you very much, dear Dr. Fadai. It was really interesting presentation. I personally enjoyed all these points you've mentioned, how auricular therapy can be helpful for relieving the complications of patients in different categories. One of the participants has asked if these books are freely available, or if you can share a link for the PDF of the books. I will later talk to you in this regard. If you could share them, I will take them from you and I will share them with our colleagues in the WhatsApp groups or via other links. So
I know.
Yes, please.
Yes, please. I know one of them is available, but two of the books, I don't think they are available, but I will see. I will see if it was available, definitely. But I prefer myself to read the textbook, because when we get the PDF and then next PDF and the information doesn't come properly, and I have not seen. And but I have all the original books, I mean, in the paper. But if it is available, definitely I will help you. Thank you.
Thank you very much. And Yeah, we have a question from Dr. Sharik Khan. So, Dr. Sharik Khan, you have microphone access. You can ask your question, please.
Yes, I am. I can, if you can, if we can
Sharik
hear
Khan,
your question.
Dr. Sharik Khan, do you hear us? You have access to microphone. You can ask your question. So there might be a problem with the microphone, or it might be just mistakenly clicking the the right hand. So I think because we are a bit behind the schedule, it's better to continue with the next speaker. So at this point, I would like to appreciate Dr. Majid Fadai and introduce you to our second speaker, Dr. Mohammad Hussein Ayati, who has been graduated as a medical doctor from Mashhad University of Medical Sciences and continued his education to take a PhD degree in traditional Chinese medicine from Beijing University of Chinese Medicine in China. He is an associate professor of Chinese medicine at Tehran University of Medical Sciences and has worked within different aspects of TCM, including acupuncture and Chinese herbal medicine. Also, as many of you definitely know, he is currently the Vice Chancellor for Global Strategies and International Affairs at Tehran University of Medical Sciences. Dear Dr. Ayati, hello and good day. It's a great pleasure for us to have you here.
Thank you very much. And I do appreciate the great talk from Dr. Fadai. I enjoyed a lot. It was very informative and very interesting. Before I start, I think there are some questions, especially one of them is from dear Dr. Abu Shankar. She asked Dr. Fadai if in the permanent methods of auricular acupuncture, did you face any kind of adaptation to the needles or not? This question was asked like, I think at the very beginning of the Dr. Fadai's talk, so it's missed here. And also Dr. Sharik Khan asked about if TOMS offers some training courses on auricular acupuncture. I can answer this one is that after this webinar, we are going to plan a short course training, a certificate-based training course on auricular acupuncture for international applicants, inshallah. So Dr. Fadai, are you?
Yes.
Yes.
First of all, Assalamu alaikum. I'm very happy to hear and to see you. And it is a pleasure to hear your voice and see you. First of all, I would like to thank Dr. Ayati because he was the one who helped us with the first of all 10 to 12 years before we introduced auricular therapy to the medical doctors. And if he was not with us, definitely we would not be successful to getting this course running. And it is my pleasure that I have worked along with him for, I think, 5-6 months. We worked together to just send the information to the university and get the acceptance. And I'm very thankful to him and very happy to see him after a long time. Now, regarding the questions, I can say, yes, when we do implantations, which goes for a long time, we can see nerve accustomization, and the body response goes down. Therefore, the Germans have produced short-term needles, which are implanted for 3 months, 6 months, 9 months. So before the adaptation, the body becomes neutralized again and the body nerves comes up. And also, we ourselves have produced very, very short stimulation, not to allow body to adapt. For example, when we do a massage 3 times a day, just we send a 20-second impulse for certain diseases, and the patient pain goes up, and body is without any changes. The pain improves, the condition improves, and patient again at noontime, again, he stimulates certain points. And what you have asked is very, very accurate and exact, that yes, body customization can take place, but various forms of needles are produced to prevent this customization. But in certain time of pain control, for example, cancer pain control, for 3 to 4 months, the patient sometimes cannot come to the hospitals. And we might just don't think about this customization. And for 3 months, we control the pain. But definitely your question is exact. Thank you very much. If there's any other question.
Okay, thank you very much, Dr. Fadel. Okay, let me share my screen. So you have my screen now, yes?
Yes, we
Okay.
have your screen right now.
Very good. So what I'm going to talk about is an evidence-based review on acupuncture. Maybe any of you, if you are interested in acupuncture or you are acupuncturist, many people may ask you at the end of the day, what is the usage of acupuncture? Or in simple words, the patients and also the medical doctors, they ask you, what are the main symptoms or medical conditions that acupuncture can cure or can alleviate the symptoms? Or in very simple words, what are the indications and contraindications of acupuncture? So when we want to answer this question, as Dr. Fadai said, we can answer through the ideas and experience of acupuncturists who are doing like clinical practice and acupuncture. In my case, it's like more than 15 years. In Dr. Fadai's case, it's more than 20 years. So we have some experiences. You know, expert opinion has a certain voice and situation and value in the field of medicine. Generally, I'm talking about all medicine, not these kinds of complementary and alternative medicine. But the other kind of answer is answering according to the current evidence, like scientific evidence being published in the papers or guidelines or textbooks. Dr. Fadai, I think in his interesting lecture, he explained both of them. He said some indications according to his experience, and at the end of the presentation, he gave us some very strong evidence, like systematic reviews, which are very good and strong and high level of evidences. So I'm going to give you some evidences about acupuncture. As our dear moderator, Dr. Baham Sultan introduced, I got my MD in like Western medicine, 7 years MD. And then I went to China. I passed 5 years in China to get a clinical PhD on Chinese medicine. Now I'm working as an associate professor in the School of Traditional Medicine, Tehran University of Medical Sciences. And currently I'm doing as the Vice Chancellor for International Affairs. And also last year I became the guest professor for Beijing University of Chinese Medicine. That is a privilege and honor for me. So directly going to our talk, the first evidence ever from a well-known organization like WHO, World Health Organization, is coming from in 1979. So it's kind of, you can say now it's 2023, is more than 40 years ago. World Health Organization gave us a list. This is the list. It's the name of list is WHO list of diseases in which acupuncture can be integrated effectively. So this was a good guide for acupuncturists, because when you are an acupuncturist, it's very difficult to choose the right patient. So if you choose from this list, you can say that I did not do anything wrong, and I have some backbone of my decision to do acupuncture, for example, for low back pain, neck pain, sciatica, tennis elbow, knee pain, periarthritis of shoulder, sprains, facial pain, and craniomandibular disorders, and so on. I'm not going to elaborate more on this list because there are some more like recent lists that we can refer to. But generally, when you look at this list, you see that the World Health Organization, I put the reference here at the bottom of the page. The World Health Organization's list consists of some certain conditions of pain. So pain is prominent here. Low back pain, neck pain, like knee pain. You can say facial pain, many other pain conditions you can see. So generally, when you view at this picture and this list, you can say, okay, I can imagine that acupuncture works for pain. Then afterwards, we will give you some more strong evidence about this phrase. There are some other symptoms here, like nausea and vomiting, morning sickness, and there are some also like psychological symptoms like depression that are, I think, prominent in this list. Then in 1998, in JAMA, Journal of American Medical Association, which is a very well-known and very important journal. I think sometimes it's, in general medicine, it's like the best journal for giving guidelines. This journal published an article. The article name is Acupuncture in 1998. And in this article, there are some certain phrases. This article was being sponsored by NIH. You know, NIH, National Institute of Health. This is the largest institute which sponsors research and grants research on medicine. So NIH is the largest granting body and the largest research center on medicine. So NIH sponsored this research, and at the end of the publication, it says that evidence demonstrates clear efficacy for a number of disorders, useful as an adjunct treatment or acceptable alternative, inclusion in a comprehensive management program, and incidence of adverse effects is lower in hands of experienced acupuncturists. So these are like some sentences from that paper. And then NIH in that paper gives us another list. Again, in the list, you see nausea and vomiting of chemotherapy, and then some pains like post-op surgery pain, post-op mental pain, myofascial pain, fibromyalgia, which is like a complicated condition in general medicine, and in like conventional medicine, it's very difficult to treat fibromyalgia because there are lots of etiologies, possible etiologies behind this fibromyalgia, but NIH says that acupuncture can help fibromyalgia, headache, carpal tunnel syndrome. You can see some symptoms in these lists, NIH list and also WHO list, that there are some pain conditions and there are some conditions which are pain plus inflammation, like carpal tunnel syndrome. The patient has pain, but there is a certain inflammation at the site, at the wrist site. Also tennis elbow, you know, in tennis elbow, the patient has inflammation on the elbow and also pain. Again, in osteoarthritis, we have inflammation and pain. So here we can say, okay, acupuncture can work for pain and acupuncture can work for inflammation. So we go on. In 2003, like the first WHO statement was 1979, and that after 24 years, it took WHO 24 years to again give us another statement. In this statement is much better than the first one, because in this statement, WHO divided the diseases and disorders that can be treated with acupuncture into 4 groups. The first group is diseases, symptoms, or conditions for which acupuncture has been proven through controlled trials to be an effective treatment. So please read this sentence again. Diseases, symptoms, or conditions for which acupuncture has been proved through controlled trials. In medicine, controlled trials has a certain meaning. It means that there has been a controlled clinical trial, an RCT, a good RCT with a good methodology, which is acceptable by WHO, and the outcome is included in this first group. So we will see the first group. I think for us, if after this session, somebody asks you, what is the use of acupuncture? If you say some of the symptoms or diseases in the first group of this WHO statement, you are absolutely right, because the first group is proved through controlled trials. And there are some other groups. For example, the second group is the group that therapeutic effect of acupuncture has been shown, but further proof is needed. It means that the number of controlled trials or the quality of controlled trials for this second group is not that good enough that the WHO put this one in this first group, put it in the second group. And the third and the fourth group are like very special groups. We will not go through them. I think we just need to learn the first group, and that will help us a lot to answer the questions from the people, from the patients, from the doctors, if they want to know what are the evidences of acupuncture. So this is the first group. We can go through them one by one. I think this is like the main point of my lecture. The first one is it's according to like alphabetic order, so A, B, C, D. So adverse reactions to radiotherapy and or chemotherapy. So this was in like before we saw it in the NIH list and also in that WHO list 24 years ago. It means like after chemotherapy and radiotherapy, the patient usually has nausea and vomiting and does not answer to chemical drugs, and chemical drugs are not applicable in many cases because the patient is complicated and there are a list of drugs that patient is taking, so we cannot easily add another prescription, another chemical drug to his list of drug regime. So, but with acupuncture, it's very easy and very effective. Don't forget that we are talking about the first group, which is proven through controlled trials. So there is no doubt about this list. So mainly it's nausea and vomiting, but after radiotherapy and chemotherapy, there might be some other adverse reactions like pain, like some kind of depression. So for all of them, acupuncture can work. The second one is allergic rhinitis. Allergic rhinitis is like a very difficult patient to care. to cure. The patient does not answer to many patients, or the severe cases does not answer to antihistaminic prescriptions, and these antihistaminic or anticholinergic prescriptions, there are lots of adverse effects for them. But with acupuncture, you can, which is proven through controlled trials, you can help your patient with allergic rhinitis and alleviate their symptoms. Biliary colic, here it means the pain from the biliary colic. Depression, it was again in the previous list. Depression is a very good condition to be cured with acupuncture. But we have bear in mind that we are just allowed to treat patients with mild to moderate depression. If a patient is in a severe depression condition, any unconventional medicine is not allowed to treat the patient. These patients have, like, for example, suicide ideas in their mind, so they should be referred to the specialized hospitals and should be under a very good monitoring and care. But for mild to moderate depression, acupuncture is great. The patient will be very satisfied with your treatment. So you can see it's amazing to see dysentery or acute bacillary dysentery here. For sure, the patient has symptoms like colic or pain, and that can be alleviated by acupuncture. Okay, dysmenorrhea, especially primary dysmenorrhea, is again another condition with pain, with lots of uncomfortable conditions. So you see, primary dysmenorrhea is in the first list of WHO. Epigastralgia, acute peptic ulcer, acute and chronic gastritis and gastrospasm, which is very, very common in the patients. Many of the patients coming to the clinics, they have like gastritis or gastralgia, and you can help them with acupuncture. Facial pain, including craniomandibular disorders, again, a common condition and a very difficult to cure condition in a conventional medicine setting. Headache, including migraine headache, again, very common and popular among the populations. Hypertension and hypotension, both of them. Induction of labor, when the process of giving birth to the child is started, but it does not go well, the dilatation stops at any stage, you can use acupuncture. Recently, I had a French friend who is working in a midwifery setting in Paris. He said that we use acupuncture in Paris for the ladies who want to give birth to their child, but they have some difficulties, and it can accelerate the process of labor and giving birth to the child. Knee pain is quite common, leukopenia, low back pain, malposition of fetus. This correction of malposition of fetus, it's interesting to know. We have a very special point. It's called bladder 67, BL67, and we do moxibustion on this bladder 67. And the mother feels that the fetus, if the fetus is not in the cephalic presentation, is breached or on the shoulder in the in that cavity, the mother will feel that the fetus is rotating and coming back to that normal cephalic position. Morning sickness, we talked about that. Nausea and vomiting, we talked about that. Neck pain, pain in dentistry. There are lots of many publications that advise the dentists to have an acupuncture setting beside their dentistry, because dentistry, many people are afraid of dentistry just because of the inconvenience and the pain. So nowadays, in many dentistry settings around the world, there is acupuncturists available before doing the some dental procedures, and after that, they do acupuncture for decrease the pain in dentistry. Periarthritis of shoulder, a condition with pain and inflammation. Post-operative pain, renal colic, rheumatoid arthritis, a severe case, a severe like disease which has pain and inflammation. Sciatica, it's very common, like low back pain with sciatalgia. A sprain, which is quite common in sportsmen and women. So in a sprain and a strain, both of them, acupuncture can work very good. So a stroke, it means like the consequences of a stroke. After the stroke, we have malfunction of the limbs, or we have pain. We have post-stroke depression, which is a quite common condition. So after a stroke, acupuncture can help a lot to different conditions of the patient. And tennis elbow. So now if someone asks you to tell him or her that what is the usage or what is the indication of acupuncture, you can name some items from this list. Again, you see that many conditions are with pain and inflammation, and some psychological like depression, anxiety, some gynecology problems like dysmenorrhea, induction of labor, malposition of fetus, and so on. This is the second list of WHO. So we don't want to like go through that. You can check it yourself. The third group and the fourth group. About the safety of acupuncture, also there are some evidences. British Medical Journal, again a very well-known journal, published in this like BMJ journal, the BMJ, published a paper. The paper's title is The Safety of Acupuncture. You see BMJ 2001. They have followed all the patients of 574 acupuncturists for a certain amount of time, I think six months. They followed all of the patients being treated with these more than 500 acupuncturists and asked them if they have any side effects or any problems. At the end of the day, at the end of like ending sentence of the conclusion of this paper says, acupuncture is very safe without any serious complications in the hands of an expert acupuncturist. This is very important. Nowadays, unfortunately, in Iran, we are seeing lots of side effects of acupuncture. Some of them are really very sad. I saw a patient like the needle entered her heart, and she had to do an open heart surgery in the age of 22. And then when we checked, we saw that that acupuncturist was not a licensed acupuncturist and just learned about acupuncture in like a 2 weeks course not in a university, in some unknown setting. And And not also, this is very important. This paper also emphasized that if you go to an expert acupuncturist with a license, with a certain amount of experience, acupuncture would be very safe. But otherwise, you may have some serious consequences. So when we talked about pain, we said that acupuncture is good for pain. So the question would be, what is the mechanism? How acupuncture works for pain? So now that they have done lots of research, animal research or clinical research on cell line research. And nowadays, we know lots of information about the mechanisms of acupuncture. One of the mechanisms is central neurotransmitters. When you do acupuncture on a patient, certain neurotransmitters, the content and turnover of these neurotransmitters change in favor of analgesia. So the patient will feel less pain. So maybe I don't have time to talk about all of these, but in the peripheral, we will have release of transmitters and hormones. There is a mechanism for inhibition of inflammation. There is a mechanism on the fibroblasts. In the spinal, we will have activation of inhibitory interneurons, release of endorphins, very important. In central nervous system, we will have release of anti-nociceptive neurotransmitters like 5-HT, 5-hydroxytryptamine, and so on. So maybe I just skipped it. There are lots of research on, for example, spinal mechanisms of acupuncture, how acupuncture works in terms of effect on the spinal nerves. And this is a paper, acupuncture-induced changes of pressure pain threshold are mediated by segmental inhibition. Let me go forward. So acupuncture works in pain medicine. In any pain settings or pain clinics, you can add acupuncture. And this is scientifically proven. You can be sure about that you are doing the right thing. In some countries, I was in Munich, in Germany, and in Munich University, they said that we just use acupuncture for pain here, and they did lots of great research there. So for summarizing acupuncture's evidence, there are some works. In this work, overview of treatment guidelines that recommend the use of acupuncture, they found 4,691 positive recommendations for acupuncture from 2,308 different publications. From this 4,691 positive recommendations, 3,117 recommendations for the use of acupuncture for 149 pain indications. So you see that about 3/4 of these 75% of all the papers, they are talking about different pain conditions, more than 100 pain conditions. And 1,574 recommendations for the use of acupuncture in non-pain indications. So you can see the numbers, you can see over 13,000 studies conducted in 60 countries, hundreds of meta-analyses, and a wide range of clinical areas like pain in cancer, pregnancy, stroke, mood disorders, sleep disorders, and inflammation. Nearly 1,000 systematic reviews of acupuncture was published in an overview in Class 1 Public Library of Science 1. You know this journal is very famous journal. And then Australian Department of Veteran Affairs summarized in 2010, and again, US Department of Veteran Affairs summarized in 2014. And there was a big project. The project name is Acupuncture Evidence Project. You can check this one. It's by John McDonald in 2017. So you see the number of publications. The first one is pain, then neoplasms, arthritis, stroke, paralysis, brain ischemia, allergy, nausea, vomiting, sleep disorders. Again, for chronic pain. So I just skip all the pains. In Cochrane Review, you know, Cochrane Review is very famous, and we can rely on the on Cochrane Review. In Cochrane Review, it gather all the systematic reviews. So to summarize, according to Cochrane Review for headache, for migraine headache, the routine care, after routine care, the patients had 5 days of pain in a month. With sham medical prophylaxis, it decreased to 4 days. And with acupuncture, it decreased to 3.5 days in a month. So according to Cochrane Review, acupuncture works for migraine headache. Again, in Cochrane Review for neck disorders, it says that there are moderate evidence for good acupuncture versus sham acupuncture and pain. And this is very good to know that Cochrane Review also accepted acupuncture for neck disorders. I just skip the others. This is for preventive nausea and vomiting, again in Cochrane Review. So in Cochrane Review, again, accepted acupuncture, especially on the point precardium 6, which is on the wrist for nausea and vomiting. And this is a very strong evidence. This is for post-operative nausea and vomiting. This is for depression, and it's amazing to see that you see for depression, this paper published in 2012, symptom reduction in a blind rating with antidepressants. The successful rate was 46%, placebo 38%, waiting list 13%, standard care just 36%, psychotherapy 47%, psychotherapy plus antidepressant, you know, antidepressant plus psychotherapy. We like expect that it works very good, but the success rate was 52%. Exercise 47% and acupuncture for 52%. So you see, for depression, acupuncture can work the same as antidepressant plus psychotherapy, and this is like a very good news and a very strong evidence. So we have the map of this evidence project I mentioned from John McDonald. They have they did this systematic review in a very tough way, and they just accepted very good with very high methodology, good methodology, clinical trials. And at the end of the day, they said that, okay, for 8 conditions, we say that acupuncture will work great, and we can treat the patient with acupuncture, just with acupuncture. It's migraine prophylaxis and headache, like migraine and migraine prophylaxis, both of them. Chronic low back pain, allergic rhinitis, knee osteoarthritis, chemotherapy-induced nausea and vomiting, post-operative nausea and vomiting, and post-operative pain. For these 8 conditions, this project, which is sponsored by the Australian Acupuncture and Chinese Medicine Association, which is under the Ministry of Health of Australia. These 8 conditions are like undoubtedly good to refer to acupuncture, and they said that if a doctor refer patients in these conditions to acupuncture, the insurance will cover all the expenses. And there are 38 conditions with potential positive effects. So these are the details of this, and these are the 8. I mentioned the 8 conditions. Now these 8 conditions are under the coverage of insurance in many countries, and these are the 38 conditions that have potential positive effect. The paper suggests that we add acupuncture to the conventional care in these conditions. And I just skip. Again, this is pain. I just go forward. This is for sciatica. This is for chronic constipation. This is very interesting to know. This is the first time I'm mentioning constipation in this lecture, but this paper from +1 says that acupuncture was more effective than drugs for treating chronic constipation. You know, chronic constipation, again, is a tough symptom and it's very difficult to treat in conventional medicine. But this paper from this meta-analysis says that acupuncture was more effective than drugs for treating chronic constipation and with the fewest side effects. This is the successful rate from the idea from the patients. From 89,000 patients reported successful treatment for musculoskeletal pain with acupuncture. More than 98% of patients who got acupuncture for musculoskeletal pain, they were satisfied with acupuncture. And this is like a huge number, a good number. And you see the sample size is very big. This evidence map is very interesting, but I don't have time to explain about that. This is again from Annals of Internal Medicine. You see the impact factor of journal. This journal is around 20, which is like very high. They gave a clinical practice guideline from American College of Physicians for acute, subacute, and chronic low back pain. And they, I did not put the the table. In this paper, they gave 4 levels of guideline for acute, subacute, and chronic low back pain. And in 3 of them, acupuncture was included as a guideline, to be recommended by physicians for chronic low back pain. Again, you see in Nature Medicine with a very high impact factor, more than 32, it talks about electroacupuncture for controlling the systemic inflammation. I said that acupuncture is good for inflammation. So thank you very much. The WHO strategy says that TNCM, which means traditional and complementary medicine, will contribute to human health care in the 21st century, and it's a long way to go. So thank you for your attending this conference, and I'm at your service for any questions. Thank you very much.
Dear Dr. Ayati, thank you very much for your presentation. It was really interesting. So we have a couple of minutes for the audience. If they have any question, you can write down your question in the chat box, or you can raise your hand so we give you microphone access. So audience appreciating these interesting data. Questions, please.
Thank you very much. I also got a heart here. Yeah, thank you, Dr. Abdushankar. Yeah. Thank you, Dr. Shah Khan, for being here with us. And have a nice day, everybody.
Well, thank you, everyone, especially our two dear great speakers for sharing their knowledge and experience in this webinar. It was our pleasure to have you all here today. And I see that we had participants from different parts of the world, from India, from Thailand, and of course from Iran. So I hope all your audience enjoyed the webinar. Of course they did.
We have Mr. Hidayatullah from Bangladesh.
Yeah, but he's currently in Iran. Yeah. So it seems that there's no question remains. So if we want to add any point, Dr. Ayati, we'll be with you.
No, I have to thank you and the School of Traditional Medicine, and also my dear colleagues, especially Ms. Sadeghi, who always helps us a lot. Take care of yourself, and looking forward for future works, especially the short-term training course on maybe auricular acupuncture in the near future, inshallah.
Thank you very much. Yeah, all those who are interested in such courses, please keep in touch with us. We will definitely share the announcement of the course whenever it is ready, and we will be happy to host you in such course. So thank you, everyone. I also want to appreciate Appraise to Raise team for supporting the executive part of the webinar, and hope everyone stays safe everywhere in the world. Thank you very much and have a nice day.